let me share my screen here. Window. There we go. There we go. Okay, can we see chapter 4, spine and thorax? Good. Cool, cool, cool. All right. So we've been kind of going down layers, right? We started on this top layer of muscle. I mean, really top layer of muscle on the back. I mean, we started on a really, really top layer when we first learned about this big diamond-shaped muscle here. Miss Nguyen, what is the diamond-shaped muscle that's on your back? It's very superficial. It's the most surface one. It's diamond-shaped. It hooks to the middle portion of your nuchal line. It inserts down into the lateral 1/3 of the clavicle, acromion process, spinous scapula, and then goes down into the spinous processes over here of your thoracic region.
I think in the chapter years.
I think you're right. Thank you. That's exactly what I want to hear. Since you're on fire right now, if the upper fibers contract, what action does this muscle create?
Elevation. I think that.
Elevation.
Elevation, yeah.
Yep, that's what you're saying, though. That's good. If the bottom fibers contract, what does that cause?
Extension.
Depression.
Yeah.
Depression.
Yeah.
Yeah? And if the middle fibers contract, what does that create?
I contrast that.
Yep. So this stuff's going to get closer to the spine, and they're going to pull back.
How about extension? Extension?
No, I appreciate what you're saying because it is happening behind you. It is happening behind you, but it would be your scapula would be kind of added back to your spine, be kind of getting closer to your spine.
Oh.
So you should retract that last statement and say something different. Yeah.
Abduction?
How about adduction? Adduction. That will add it back to the spine, or retraction.
Yeah.
Retraction? Or yeah. Cool. All right. And because of the way that the traps grab on to the scapula, is it also possible for them to upwardly and downwardly rotate, or at least upwardly rotate, the scapula? Just say yes.
Yeah.
Yeah. You can get some rotation too with these traps working. Cool. Thank you.
Yeah.
Boom. And then Miss Yanez. And then the traps share an attachment. Their insertion is another muscle's origin. And what is that muscle? It's named by its shape.
Is it the deltoid?
It is the deltoid all day long. Good. So remember the traps kind of go down in here into the shoulder here, and the deltoid seamlessly just takes off after that. Yeah. And the deltoid comes down into a delta, a point, and inserts into what tuberosity on the humerus?
Isn't it the deltoid tuberosity?
It sure is. Good. It inserts in the deltoid tuberosity on the humerus. Awesome. Cool. And what can the front fibers of the anterior fibers, let me use correct verbiage here, the anterior fibers of the deltoid do if they contract?
A flexion.
A flexion for sure. They also go at a diagonal, so they can also cause a rotation too. What kind of rotation?
A medial rotation.
Thank you. What do the rear fibers can do?
An extension.
An extension, thank you. Or a, what kind of rotation?
Lateral rotation.
And what do the middle fibers do?
An abduction.
Thank you. That was beautiful. Is there anything else By the way, there's one other thing the front fibers can do.
They can horizontally adduct.
Awesome. Thank you, ma'am. Okay. Miss Monreal.
Yes.
If I tear off the trapezius and the deltoid that work together to give me actions like this, because they actually lift up my shoulder and lift up my glenohumeral joint, all that. But if I tear them all off, I will be able to see the 4 rotator cuff muscles that live on the scapula. 4 rotator cuff muscles that live on the scapula. They all have origins on the scapula. What are their names?
I'm so
I like this kind of shelf thing. Good.
Okay. So I know you were saying rotator cuff muscles. Somebody was talking to me. I'm so sorry.
That's okay. That's okay. What are their names of the 4 rotator cuff muscles?
Okay. I know it's the sits.
Good.
So hold on. Give me a second. So supraspinatus, infraspinatus, teres minor, and subscapularis.
Beautiful, and I love the way you said it. All right. So all 4 connect to what bone?
Humerus.
Yes. Yeah. And actually 3 of them connect to what tubercle on the humerus?
I'm gonna guess greater. I don't know.
That's a good guess. Yep, and the subscapularis attaches to the lesser.
Okay.
Beautiful. Okay, so what action does the supraspinatus create? The one on top.
Hold on, because I was getting confused with these. So that's abduction.
You are 100% correct. Thank you.
Okay.
What action does the subscapularis create?
Does it what is this? Medial rotation?
100%. 100%
Okay.
correct. It's actually, even though it's under the scapula, it's in front of it, right? And when it pulls, it creates a medial rotation. Beautifully done. What action does the infraspinatus on the posterior side create?
The lateral rotation?
That is 100% correct. What action does the teres minor create?
Would it be the same as the infraspinatus?
Yep, it's a trick question to
Okay.
make sure you know to put those together. Because
Okay.
anytime I say teres minor, you say,
Infraspinatus.
anytime I say infraspinatus, you say,
Teres minor.
thank you. That was beautiful. Really well done. And they all help, by the way, to stabilize the shoulder and, you know, create a stronger shoulder socket and all that kind of stuff. But those are the 4 rotator cuff muscles. Thank you. Well done. Miss Petrie. Over on the medial border of the scapula, kind of going up at an angle a little bit, are 2 muscles here. One's about 4 fingers wide, the other one's 2 fingers wide. That attach to the spinous processes here and attach to the medial border of the scapula. Do you know what those 2 muscles are?
The rhomboids major and minor, but the minor comes on top of the major.
Wow, excellent. Well done. Well done. And can you tell me what 2 actions they would have? Kind of remember they run diagonal like this. So if they contract,
Right.
What's going to happen to the scapula if they contract?
The scapula is going to pull together and immediate into the middle,
Yes.
which would be a, oh God, what do we call that?
Yeah. But at least you know what they're going to do. I'm really happy about that. But yeah, just kind of take all those facts and add them together in your head and you'll know. You'll know.
It's called a, I'm doing the action, but I can't say the word.
Yeah. There's actually 2 things it's called in a way.
a contraction,
They all contract. Every muscle contracts.
right. It's called a,
Oh, I know what you're trying to think of. Yeah, it is. That's, yeah, a something action.
oh God. I can't think of the word.
Yeah.
Yeah, I see the
Do
action.
you want me to
do the action, but I can't say what it is.
do you want me to retract that question and give you a different one?
It's called a retraction.
Yeah. Can you tell me?
Not a contraction. It's called a retraction.
Yeah, that's good though. You knew what the action was. I'm very, very happy. So what's the other thing we call this when it gets closer to the midline? Retraction's 100% correct.
It would be a medial.
Well, no, not yes. It is going medial. You're absolutely right. But we call this something when you add something closer to the midline.
Oh, an adduction.
Thank you. So it's a retraction and adduction. Both are correct. That's beautiful. Okay, so that's the same action though. There's one more action that these fibers will kind of create too because they run diagonally. And what's that?
Okay, that would be an elevation.
Yes. Really good.
Okay.
Awesome. Awesome. You nailed it. Cool.
Sorry
I love
about
it.
that.
No, don't be sorry. That was great. It was fun. There was other people like trying to mouth it out to you too. They're like, retraction. It was great. I loved it. It's good.
Well, thank you, everyone.
Thank you. Thank you. But what I really liked, by the way, not to single you out, Miss Petrie, but since we're talking, what I really liked was that I really felt like you didn't memorize the actions. You actually visualized them. You said, this is what's going to happen. And if you don't have to memorize, you'll know it forever, right? You can now look at a fiber and be like, well, that sucker's going to go over here. I don't remember what that's called, but it's some action, reaction, something. Yeah, which is fantastic. You're doing it. Ms. Torres.
Yes.
Ms. Torres.
I can't see you.
Oh, you can't see me?
So I don't know why.
Okay. Well, I will describe to you the muscle I'm about to talk about, which will make it much more difficult, but you need a challenge. You like a challenge. You live for challenges. What? All right. Miss
Yeah, sure.
Miss Petrie just correctly identified the rhomboids major and minor. We're kind of working our way up the medial border of the scapula, and the rhomboid major starts at the inferior angle of the scapula on the medial border, and you work your way up, and then you get the rhomboid minor, as she correctly identified, is on top of the major. And that gets you up to about the medial border, about at the spine of the scapula across from it. If you go up higher, still on the medial border, but right up to the superior angle of the scapula, there's another muscle that shoots off this medial border and goes up to the transverse processes of C1, C2, C3, and C4. What is that muscle?
Is it the elevator scapula?
It is. It's the levator scapula, but I don't mind you calling it elevator scapula because that's what it does. Beautifully said. Levator scapula. Really well done. Cool. And now you've told me the action too, because the action is the name. Really well done. Good job. And we've now just described all the muscles that kind of run up that border of the scapula that you guys grab when you grab a scapula. Well done. Cool. Thank you, ma'am. Mr. Kandaris. Miss Petrie told us about the rhomboids major and minor, and explained that they retract or adduct and elevate the scapula a bit. There are some muscles that, sorry, I'm having a brain whatever here. There are some muscles that do the opposite of those actions. They protract or abduct or depress the scapula, and they can argue with the rhomboids. I'm thinking of two muscles in particular here. Can you tell me what those two muscles are?
When I ask for a clue real quick, are they superficial or are they deep muscles?
Here's a clue for you. Can you see me?
Yes. Serratus.
Yes, thank you. Thank you for getting that clue. Serratus anterior attaches to the medial border of the scapula, but from the front, and it inserts into the first 8 or 9 ribs. And it looks like fingers coming down on here. Yes, serratus anterior. Can you tell me the second muscle?
Patch.
Which ones?
Plural. Major and minor. Well, looks like you're doing minor.
Yeah.
Based on the
Yeah.
sign.
So I'm doing minor because minor actually inserts into the, it's got a, yeah, inserts into the coracoid process of the scapula. So when it pulls the scapula. Does the major insert into the scapula, sir?
No.
No. So don't forget, everybody, the major and the minor have nothing to do with each other. I'm not saying they don't ever work together or whatever, but the major hooks to your arm and moves your arm around. The minor hooks to your scapula, moves your scapula around. It might pull the arm along for a ride, but it's not moving the arm. Cool? And sir,
Yeah.
what nerve plexus can the pectoralis minor pinch on that goes to your arm?
The opposite of central.
Oh, that's true. Thank you. It is part of the peripheral nervous system. Excellent answer. Yes. Now this is definitely a peripheral nerve, and you nailed it, and I appreciate that. But this particular nerve is involved in thoracic outlet syndrome, and it goes to the arm. It's actually named the arm nerve, the arm plexus, but they don't use the word arm. They use
Brachial.
brachial plexus. Thank you very much, sir. Awesome. Good job. Good job. So that, remember, that muscle can pinch on the brachial nerve, which feeds the whole arm, everybody. Comes out of the side of the neck, goes underneath the clavicle, goes down here. Cool. And the pec minor can either pinch on it or pull the scapula down hard enough that the clavicle pinches on it. Very cool. Good stuff. Good stuff. Okay, Miss Hunter. You said you're feeling good today? You got some hummus in you?
I mean, my body feels good. I don't know about my brain.
Oh. Well, let's find out. Let's see. I've got some other muscles that we don't talk about as much. So I apologize. We have talked about them before. We've taken a test on them, but I don't review them as much. But we have a muscle that goes from our coracoid process over to the middle medial part of the humerus. Coracoid process over to the brachii. Do you know what that muscle is called?
Brachii.
Good.
Is it like a bicep?
Goes, nope, bicep. Well, by the way, you're not that far off for other reasons we'll get into, but this goes from the coracoid process over to the brachial region, the middle part here.
It's a muscle?
Yeah, it's a cute little muscle. We don't talk about it much. We have before, but yeah. I like it because it's named by its origin and insertion, essentially.
Oh my gosh. I know what you're talking about, but I don't remember it.
Okay. Well,
okay, yeah.
do you remember any muscles that have something that sounds like coracoid in them and brachial in them?
No. Coracoid brachii muscle?
You don't realize how close what you just said was. Coracobrachialis.
Oh, okay.
All right. So this muscle runs kind of diagonal from here to here. Looks like this. What actions do you think it could create? Just guess.
Flexion?
Yeah, I would guess flexion too. I'm not looking in the book, but I would guess flexion. I don't even care if we're right because our thinking is right. Definitely a flexion. What other action could it cause?
That's abduction. That's not abduction. That's horizontal extension.
I'm adding it back to the midline. Horizontal.
Oh, you're going flat. Oh yeah, horizontal abduction.
Adduction. Cool. Good job. Good job. I was also just kind of trying to show everybody that even with a muscle that you don't remember, you can figure out its actions. Good job. Really good job. Cool. Thank you. Let's leave it at that for now. Have some more hummus and we'll come back to you. Miss Cooper. Miss Cooper, there is a two-headed muscle that lives on the anterior side of the arm. Two-headed muscle that lives here in the brachial region. What's it called?
Is the triceps brachii?
Two-headed muscle.
Oh, biceps brachii.
Biceps brachii. Awesome. Biceps brachii is in front. Yes. What? And it crosses over the elbow here. What main action does it cause?
Flexion of the arm.
Flexion of the elbow. Yeah. It actually does create flexion of the arm as well because it reaches across the shoulder. Yeah. Very good. Miss Cooper, what is the muscle that's found on the back side of the arm, on the posterior arm? It's the only muscle found on the back side of the arm.
Well, that would be what I said first. Yeah, triceps brachii.
Yes. And what's that muscle's main action?
Extension.
Yes. Very well done. So biceps, triceps. Awesome. Yes. And triceps, because there's a long head that crosses over the shoulder, can even have a little bit to do with extension as well. Yes, you're absolutely right. Of the shoulder, not just the elbow. Cool, cool, cool. Really good job. Thank you, thank you, thank you. And let me ask you one last question, Miss Cooper. And this is because I just remember, I didn't know this, and you guys taught it to me last week. Which heads actually, from the bicep and the tricep, cross over and actually attach, like, onto the scapula? Really? I mean,
Which head?
yeah, which head? I'm sorry, let me make that more clear because really there's three heads that do this. Which head attaches right above the glenoid fossa on the supraglenoid tubercle, and which head attaches to the infraglenoid tubercle right below the glenoid fossa? So here and here. One is the tricep and one is the bicep. The tricep actually attaches here and the bicep actually attaches here. Which heads are they? Long or short?
Well, the short one would be on
No.
the top and the long one would be the bottom.
They're both long. So the long head of the bicep goes to the top, the long head of the tricep goes to the bottom. And I was really saying that to review it for myself. To
Okay.
remind myself, because I got that wrong last week. So thank you for helping me
I
study.
have two.
Yeah. Cool. Awesome. Okay, Miss Hanson. Hi, Miss Hanson. If I rip off the biceps brachii on the top, on the anterior portion of the arm, there is a muscle underneath it. All it does is flex the elbow. That's all it can do. It's just, that's all it does all day long is flex the elbow. It's in the brachial region too. Kind of the bottom half of it, the distal part of it. What's it called?
Brachii?
Brachialis.
Brachialis.
Yeah, very cool though. Good. I'll take it. Let me ask you one more question since I've got you there. What is arguably the largest muscle of the upper body that creates a powerful adduction of the glenohumeral joint and extension of the glenohumeral joint? Essentially, its job is to bring the arm back down to the body.
The latissimus dorsi?
Yes, latissimus dorsi. Awesome. Awesome. By the way, anytime I say latissimus dorsi, you say?
Teres major?
Yes, you do. Thank you. Because they both do the same thing. They're not nearly the same size, but they both basically go to the same place and basically do the same thing. They're basically found up in here, up in the axillary region. That was wonderful. Thank you. Okay. Miss Harper. Hi, Miss Harper. After we looked at all those muscles, Miss Harper, then we looked at this group of muscles that run up the spine, and they help keep your spine erect, really. What's that group called?
the erector spinae muscle.
Yeah. And what's the main action of the erector spinae group?
What's the name?
Stretch weight.
Yeah.
What?
I can see. Yeah.
Oh,
It's like retraction or bending.
I love that. Yeah? What do you call when we bend behind ourselves in general? Bending in front is called a flexion. Extension. Yeah, extension. They extend the spine. They extend the vertebrae of the spine. They pull it back. Yes, the spine, the head, all that stuff. They pull it back. Beautiful. That's if they're working bilaterally, both sides, right? If they're working unilaterally, what do they tend to do?
That's the extent. Flexion.
Lateral flexion. It's called a lateral flexion. I don't know why. I almost wish they called it like a abduction because you're kind of going away from your own midline. But anyway, lateral flexion. Cool. Thank you. Ms. Harper, what are the names of the three erector spinae group muscles going from most medial to most lateral? What are their names?
The medial is the spinalis. The after that not the most lateral but the middle there is the longissimus, and then the most lateral is the iliocostalis.
Iliocostalis. That's beautiful. Which one of those three muscles basically attaches to your hip, your hip and your ribs?
That's the iliocostalis.
Yeah, it's named hip rib muscle. Cool. Which one inserts into the mastoid process of the temporal bone?
That's the longissimus.
Thank you. Yes. Okay, that's really good. You're kind of on fire, though. I want to ask you a hard question. Not that those weren't hard, but you made them seem easy. So, this longissimus attaches into the mastoid process of the temporal bone. Do you know two other muscles now that attach to the mastoid process of the temporal bone?
That's the SpleniusCC. No.
Yes, no, you're right. It just took me a second to put together what you were saying. Splenius capitis?
Yes, and
Yes.
the one that we.
It goes from the sternum and the clavicle to the mastoid process.
Oh, that's the. Yeah,
Sternal.
it's here.
So it's called sternocleidomastoid.
Okay.
Yeah,
Yeah.
we haven't really learned about that one. I just keep bringing it up, but we're going to get to it eventually. So, were you going to say another one? Did I miss one?
No, I thought it's the. Yeah, I'm wrong.
Good. Okay. I'm sorry, but I'm glad you're wrong because I was like, did I miss one? Okay. So that's interesting. So we now found three pretty important muscles that attach to this mastoid process here at the temporal bone. Thank you so much. Thank you. Miss Stanley. Miss Stanley, we learned, oh, there you are, good. We learned just now about the splenius capitis. There's also another muscle that sounds a little bit like it, but it goes from the spinous processes into the transverse processes of the cervical region. And what's that muscle? Or splenius? Because it goes in the cervical region, not the head. So it's not splenius capitis. Yes.
I don't want to say it's stupid. Cervicis?
Cervicis, I think, is right. So splenius cervicis. Cool. Thank you. I don't really have much more to ask you about that one right now. Have I forgotten any muscles so far? I don't think so. I think that's a lot of what you guys have covered. You're really doing well. Okay. All right, so let's see. Did we get splenius capitis, sternocleidomastoid, cervicis, levator scapula, suprarhomboids, infras, teres minor, teres major, triceps, biceps, erector spinae. Wow, you guys are learning a lot of stuff. Okay. Very, very cool. So today, we're going to learn about some very, very deep neck muscles underneath the semispinalis. Oh, I didn't tell you guys about the semispinalis capitis. Remember that one? Sorry, I forgot. The speed bumps of your back, of your neck. They make up these speed bumps here. Semispinalis capitis. I forgot about that. Grab on the transverse processes and go up there. Yeah. Semispinalis capitis. Sorry about that. Miss Bilotic. That also reminded me of another two muscles I didn't tell you guys about. Miss Bilotic, what are the shoelaces of the back? And I don't know that anybody else calls them that, but I do.
The shoelace?
Yeah, they look like shoelaces on the back. They're adorable. They're super deep. And they go from spinous processes down to transverse processes on other vertebrae. And so they look like little shoelaces. One goes from like the spinous process of one vertebrae and drops down 1 to 2 vertebrae and grabs onto that transverse process. The other one grabs onto the spinous process, drops down to like 2 to 4 vertebrae and locks onto that. But they look the same, really.
I don't remember.
Okay. Let me think if I can give you a hint. I can't think of one really. One's got the word multi in it.
Multifidus or
Yeah. Yes. Yes. I always say it wrong too. I say multifidi, but it's multifidus. And the other one helps you rotate. What's that one? It actually helps you extend, but it does help you rotate. So it's got the word.
Are you saying that they do help you rotate?
Well, they do actually help you rotate. But I'm saying the other one has the word rotate in it, kind of.
Oh.
Multifidus and rotatories.
Oh.
Multifidus and rotatories. That's the two muscles I forgot to tell you guys
I
about.
have it in the notes. Oh my gosh.
I believe
Sorry.
you do. Don't be sorry. It's okay. That's why we're reviewing. We're all good. Here's kind of a picture of them in this slide right here.
Oh my goodness.
Yeah.
I should know that.
Well, I don't know if you should know it. We've just gone over an awful lot of material in this class.
Yeah.
So this has been, by the way, the most academically challenging class I've taught in massage. We've ramped stuff up every year, and so you guys are you're not on the Disney ride, you know. Okay, let's move right along. Let's talk about going even deeper. So we've gone underneath the splenius capitis, the semispinalis capitis, all that stuff. And we are in a group of 8 muscles here, 4 on each side, that are called the suboccipitals. This bone back here in your skull is called the occiput. This is the occipital region. And these muscles lie underneath the occiput, and so they're called suboccipitals. They are tiny. Take 2 fingers here and put them like this, and that's about how much space they take up. Right there. That's it. So why would we care about teaching you about such tiny muscles as these? Anybody?
These muscles usually kind of get ignored in a sense.
Oh, I love that answer.
Uh,
I love that answer. They do get ignored by a lot of massage therapists, yeah. That's for sure.
and you can help by relaxing these muscles, so that way when the head is relaxed, you can have more rotation of the neck, so you can get into deeper muscles that are more problem-somatic area, I guess
Sure.
you would say.
I'll take it. I'll take it. Thank you. Thank you. And they are really ignored. You're absolutely right. Ms. Monreal, were you going to say something too?
What was your question? Why would you want to massage small muscles or these particular muscles, even though they're small?
These particular muscles, yeah. But,
Okay.
yeah, why are we learning about them? Why do we care?
Well, I think because if they're tight, they're going to pull the spine out of alignment right there.
Yeah.
I don't know. That's
Yeah, no. You're basically along the right lines too. So we literally think that the head, these muscles, by the way, their job is to kind of help me do like what a bobblehead can do. Like their job is to help my head, like do these little wiggles to my head. But essentially, they're part of what helps me screw my head onto my spine. And I always make this joke with clients because they're like, wow, that's really tight back there. And it really feels good though when you work it and all that kind of stuff. And I'm like, well, yeah, your head's kind of screwed on too tight. And that joke is kind of true. So, I mean, obviously their head wasn't screwed on, but these muscles can get really tight and they can compact the first couple of vertebrae. And we want to open up spacing in that area again. These are definitely headache muscles. Yeah. And Miss Petrie's right. Miss Monreal's right too. They're often ignored. They really are. So, essentially, we're about to learn about the origins and insertions of these muscles. But I don't want you to get too lost in them. What I want you to really remember about these two muscles, about these four muscles, these four pairs of muscles, which is why there's 8 in total, 4 on each side, is that they attach the occipital region to C1 and C2.
Mr. Tapscott.
Yeah.
So then the answer to your question is because they will compact.
Yeah. They'll compact.
Right there?
They'll compact the head in C1 and C2, and there's a lot of nerves coming out in that area.
Okay.
Yeah. And I literally, when I'm trying to massage them, I actually pretend like I'm trying to make space between the vertebrae. I don't know that I actually can, but that's what I'm pretending to do. So they really do basically sew your occiput, your skull, onto C1 and C2. And sew C1 and C2 together too. And they allow you to do lots of little articulations like this, but it's more to me that I care about the spacing. They can get very impacted in there. And don't be afraid to work on necks, especially on the back side of necks. They're very strong. Just don't whip them around fast, but they're very strong. And you can dig back in there as much as somebody will allow you to. Now, some people are very sensitive back there, but it's a really good area to work. Really good area to work. So, we're going to learn about the rectus capitis posterior minor. And if there's a rectus capitis posterior minor, there must be a rectus capitis posterior major. And the minor is kind of on top of the major in this slide, kind of. And then an oblique capitis superior and oblique capitis inferior. Oblique means they run at an angle, although I admit all of these muscles run at an angle. I don't know who named these things. I don't even care. Most massage therapists never, ever use their names. In fact, most massage therapists, including myself, would have a hard time naming these four muscles. We just call them the suboccipitals. Yeah. So you'll hear me refer to the suboccipitals. I do want to be able to, by the way, to go to you. I expect you as a massage therapist for me to be able to go to you and say, where are your suboccipitals? And you'd be able to go right here. And if I said, well, where do I find them? You'd be like, well, the suboccipital region in C1 and C2. Boom, done. You should know that, though. You should know that they tie all that together, even if you don't know their precise exact names and all that kind of stuff. Cool? So let's talk about this. We've already talked about these. Let's pop along here really quickly. Here we go. So this is one of those great slides they do where they only show you half the muscles and they show them on different sides to help you kind of see where they go. And the rectus capitis posterior minor goes from the skull down to a tubercle. Do they say it on here? I hope they do. Hold on. Don't worry about this yet. Let me see. Minor, yes. tubercle of the arch of C1. So, let me explain this really quick because it gets really confusing. And it doesn't have to be. Again, we really just care that you've got 8 suboccipitals, 4 pairs, and they're back here and they fill in this space right here. And that we're going to work on, right? What was the thing that made C1 different? Miss Felix Osuna. What is the thing that makes C1 different from all your other vertebrae?
It doesn't have the little bump.
It doesn't have the little bump. What do we call you? You're 100% right. What do we call these little bumps?
Was it the spinous?
Spinous bumpus?
No.
You're right about spinous. Spinous processes.
Process.
It doesn't have a spinous process, but it does have a tiny little bump on it. A little teeny tubercle. It doesn't have a spinous process, but it has a tiny tubercle that this muscle attaches to. That this muscle attaches to this rectus capitis posterior minor. Again, I don't get too tied up in this. I just, remember these go to C1 and C2. I just want to explain to you that it attaches to that. Because there's nothing else to attach to back here. There's a tiny little bump and it attaches to that. And all of these, I think, have origins on the inferior nuchal line. Let me make sure they're right. Oh, that's nitpicky. All right. Bear with me a second. So, you've got this rectus capitis posterior minor going down to C1, right? And rectus capitis posterior major going down the spinous process of C2. So these rectus capitis posterior muscles attach this occipital region kind of to the spinous processes of C1 and C2, but C1 does not have a spinous process. It's got a little bump that we call the tubercle of the posterior arch of the atlas of C1. And no, don't feel like you have to memorize that. Just remember there's a little bump back here because there isn't a spinous process. My point is these two muscles come down here and one hooks on to the bump where the spinous process would be of C1. The other one hooks on the spinous process of C2. So these rectus capitis posterior muscles grab on to the middle of C1 and C2. The spinous process or the bump, right? And because they're kind of coming at an angle, they can help to extend your head back, but they can also help to tilt it. Little tilts, by the way, really little tilts right in here. If my neck starts to get involved, that's a whole bunch of other muscles. So usually you're using this with other muscles, so that's the rectus capitis muscles. Then you've got the oblique capitis muscles, and they like to grab onto transverse processes. So the oblique capitis superior comes down, right? And grabs onto the transverse process of C1. Boom. Oh, sorry, I'm doing it back. C1 here. And then the inferior, the oblique capitis inferior, ties that transverse process down to the spinous process of C2. They both meet, though, at the transverse process of C1. And I know this is kind of confusing. The muscles are extremely important. You remembering the origin insertion for each of these 4 muscles is not extremely important. It is extremely important that you remember that they can be found kind of below the inferior nuchal line, way down here in the skull, and C1 and C2. That's it. Right? That's it. And that they help the head kind of wobble around and bend back a little bit. Let's see what actions they say they do. Rock and tilt, yeah. Rock and tilt back into an extension. Rotate the head a little bit, laterally flex, but that's rock and tilt. Yeah, not surprised. Sorry, everybody. So rectus capitis posterior major and minor grab onto spinous processes or places where spinous processes should be of C1 and C2. And oblique capitis superior and inferior both meet at the transverse process of C1. One is connecting C1 to C2. The other one is connecting C1 to the head. So again, all of these kind of connect your head to C1 and C2. Those are the suboccipitals. There are 4 on each side. 8 muscles that live in this tiny 2-fingered area right back here. Yay, suboccipitals. When you are trying to massage somebody with them, this is where anatomy comes in. It's very helpful. All right, let's take, this is the back of a skull. This is the back of a spine. Let me get this skeleton out of the way because I think it's kind of messed up the picture. We've got a lot of muscles going over. These suboccipitals are really, really deep, right? Yes? Yes, yes, yes? Good. Okay. Let's talk about the muscles we have to get through to get to these suboccipitals. The most superficial is the big diamond-shaped muscle that goes out to your shoulders and down to your back. Yeah. Mr. Gondaris, what's that big diamond-shaped muscle that goes out from your back of your head, out to your shoulders, down your back?
Trapezius.
Thank you, sir. So let's rip off the trapezius. Boom. Right? Then we learned that we've got this muscle that goes from your spinous processes kind of up here to your head. It's kind of in the way too. That's your splenius capitis. Right? The semispinalis capitis is here too. We rip all that off, and then we can get in here. So I can't really rip those off on a client. I can't really rip those off on a client. So what position should I put the head in to best get at the suboccipitals? Not the client should not put their head in any position. What position should I put the client's head in to best get at the suboccipitals? Okay, I just didn't hear you. Say it again, Ms. Doris.
Prone position?
In the what? Prone position? I actually, by the way, you're not wrong. Prone position.
Yes.
Would it be tilting the head to the same side?
The same side? Yeah?
Yeah.
As the ones you're working?
Depending on which side, right or left, the same side that you're working on.
And why would you do that, Ms. Petrie? Why would you do that?
Then you're contracting the area so you can better sit your fingers into those small muscles.
You're essentially right, by the way. Here's the deal, everybody. Let's take something like here. This is the semispinalis capitis. Kind of. Hold on. There's a whole bunch of muscles back here that we just talked about, but here's the semispinalis capitis. If this thing works bilaterally, what does it cause my head and neck to do?
Extend.
Thank you. Extend. Thank you, thank you, thank you. But if this is, I don't want to confuse you guys. I didn't mention this in the beginning of class because it would have been one more thing. And these fibers shorten if that happens, right? That's if the client does it. But if I do it for the client, what happens to these fibers? If the client pulls their head down, these fibers get short and tight this way. If I pull their head down, what happens to these fibers? They get loose. Because they're in the position they should be contracted, but they're not contracting, so these fibers are loose. And this is what Ms. Petrie was talking about. Because if they get loose, I can get into them and get into the suboccipitals. If they're tight, I can't get into the suboccipitals. I keep getting hung up on splenius capitis, semispinalis capitis, trapezius, all that stuff causes an extension of the head. And if I ask the client to extend, that won't help me either because they'll pull these down and they'll still be tight. But if I move the client's head down, then these things are loose and I can go through them and get to where I want to go. Which is what Ms. Petrie...
How would we do that?
You literally would just take their head and rock it. So, yeah, you do it all the time. You probably don't even think about it. But I'll try to come into class and show you because I love this kind of work. But you cup the back of their head like this when they're laying on their spine, supine on their spine, and you just articulate their head back over your fingers. And now all those muscles are loose and you're up there in their suboccipitals, which is what Miss Petrie was talking about. She's like, I bend the head to the same side that I'm working on.
I see. Okay.
Was that right, Miss Petrie? That's what you meant, I'm assuming. Yeah. And she's saying that from years of experience of doing massage. She's like, I just kind of figured that out, I'm sure. That it was a lot easier to get in deeper if I can get this area loose. And so she put it in the position where it would be tight, but the client wasn't doing it for themselves. So those muscles are loose. So don't forget this visual. This visual is, any muscle works this way. If this muscle works and contracts, yes, it will pull down, yes, it will be tight. But if I move it for it, it will actually have slack now, and it's easier for me to get deeper. And this is like a key massage therapy trick that many massage therapists don't use. Right? So if I want to get to deeper muscles, and you've got other muscles on top, I create the action of those muscles. I don't have you create it. I create the action of those muscles, and that puts them in a loose position.
Simon, when you do I don't want to say it's a pet massage, but it might be an afferrage. When you put the lotion on and then you come up to the neck and you do that cupping at the top where you just hold it for a few seconds? It's the same thing as if somebody wears supine. You just hold it and you do the curve for them.
That's a beautiful explanation.
Oh, I see.
That's a beautiful explanation. Thank you, Ms. Petrie.
Thank you.
Thank you.
Question regarding what you just said, Mr. Tapscott,
Sure.
regarding the having someone not do the action, you do the action for them, and that way you can get to the muscle deeper. Can that be said with most areas of the body during massage?
I think it could be said with all. I think it is a universal rule. I'm just saying I think because maybe we'll discover someplace where it's not true, but it's really true everywhere. Let me give you a really simple example. Right now, my bicep is taut. It's at its longest point. Now, if I flex it, it's still taut because it's shortening itself and it's taut. But if I lift my arm up by itself, it's loose, which means I can more easily now get to the brachialis underneath it. So if for some reason I want to massage just the brachialis, I would put this muscle up like this and it'd be all soft. I'd go through it because it's not stopping me and get to the brachialis. But if this arm's out, look what it just did. It actually even lifted up my finger a little bit. Even though it's not contracting, it's stretched now, so it's actually stopping me. But if I put it in its soft position, I can go through it. And that's exactly what you're trying to do. You're trying to take the steak and let it be like saggy so you get to the steak underneath the steak.
So when people are like on the table and they're tense up, then it's almost like I'm not going to be able to provide the best service because your body is tense. Or sometimes they do that because they're nervous of what's going to happen next or something. But I know a certain someone in the class who is very I'll be like, stop helping me or whatever because I want their body to be loose, but it's hard to do that.
Yes. How well does it work when you tell them to stop helping you?
It doesn't help.
Yeah. My rule of thumb is I ask people once, hey, you don't need to help, or hey, can you let this go? But if that doesn't work, I don't ask them again because it makes them think about it more. Okay. It's just psychological. And you just accept it. And it's not a big, and I know you're not saying it is, it's not a big deal. You will also get clients, I don't think this is true about anybody in the class, but you will get like male clients that come in and think they like really deep massage, and then they kind of flex through the whole thing because it's hurting them, and they don't want to tell you to back off because they're kind of, it hurts their ego or whatever. So you get that kind of stuff going on too. So there's lots of those kind of things, but you're absolutely right. If you are like, let's say I'm doing rubbing your back, this is where I notice it the most, and you're flexing your spinal erectors, your erector spinae group. I'm not going to get down to your rotatories and multifidi. I can't say it right now, man. Anyway, but I'm not going to get down to those lower muscles. And if you contract your neck back, I'm not going to get to your suboccipitals. Right?
Okay.
Yeah. So that is actually why I originally started putting movement in my massage. I wasn't even doing it for really fancy reasons. I was doing it because it kind of tricks your brain to be like, I don't know where this guy's going with my hands. So eventually they stopped helping me. Yeah. Good questions though. And yes, this works on everything. If there's a deeper muscle you want to get down to, create the action of the more surface muscle. Don't have them create it though, because they'll be contracting. You create it and you'll put it in a floppy mode. You'll create slack in the muscle and you can get down deeper. Yeah.
Can we have a break?
Yes, we can. Let's have a break. Thank you. Break, everybody. 10 minutes. Just because Miss Monreal asked.